It's the end of Women's Month, but that doesn't mean the end of the fight against GBV and femicide. So says Justice and Correctional Services Minister Ronald Lamola. Lamola and National Director of Public Prosecutions Shamila Batohi opened the 8th refurbished Thuthuzela Care Center at Victoria Hospital in Cape Town today. These TCCs are one-stop facilities that were introduced as a critical part of South Africa's anti-rape strategy. But due to demand, the mandate has since been expanded to include services for all GBV victims. There are now 61 Thuthuzela Care Centers countrywide. Ayesha Ismail reports.
Violence against women remains unacceptably high. Authorities believe they are playing their part to assist victims of GBV by providing them with easily accessible services. These Thuthuzela Care Centers are led by the National Prosecuting Authority's Sexual Offences and Community Affairs Unit, partnering with various stakeholders. They function as a multidisciplinary team consisting of police, prosecuting authorities, social development, health, and a variety of NGOs.
And so the ethos around the Thuthuzela Center is that we take a victim and we empower them to become survivors that are able to go through the system empowered, strengthened, and to be able to go through the criminal justice system. And so what are those pretrial services? They are psychosocial services, they are the medical services, as well as the legal services provided under one roof.
It has also become easier for GBV victims to report cases.
We've also now extended the service to include that you can now report at the TCC rather than go to a police station. And so that is our collaboration with the police, because they will be present at the TCC.
Those working with GBV victims say the TCC's integrated approach is one of respect, comfort, restoring dignity, and ensuring justice for those affected.
As you walk in, you'll really feel that sense of safety, that sense of comfort, that there are going to be people there to be able to support you through this journey after such a very traumatic event already. So these TCCs are valuable in all ways.
The National Director of Public Prosecutions, Shamila Batohi, says the care centres ensure that victims get all the support they need. She also stressed the importance of DNA and other forensic evidence.
If you're able to get forensic evidence quickly, it means that the chances of you getting a successful prosecution at the end of the day are much higher. And that is why the conviction rate of cases that go through the Thuthuzela Care Centers are much higher.
Authorities are appealing to victims to report their cases to the Thuthuzela Care Centers so that they can deal with the trauma inflicted on them and the perpetrators can be brought to book. They say GBV perpetrators are often repeat offenders. Ayesha Ismail, Cape Town.